Hello, I'm Dr. Noelle Clobin. I'm a gynecologic oncologist with Texas Oncology in Fort Worth, and I'm also the co-chair of the Gynecologic Oncology Group Foundation's Communications Committee. And I'm excited to relaunch the Accrual Culture series. This was originally launched in 2021 as a series of videos and conversations on how to create a successful research network at your site. This series will be focusing on the top points for site selection. So we hope you enjoy the next series of videos. Thank you. I'm here today with Dr. Adrienne Mallon, who will be focusing on our first topic, which is enrollment. Adrienne, would you like to introduce yourself?
Hi, thank you so much for inviting me to this series. My name is Adrienne Mallon, and I am a GYN oncologist at Minnesota Oncology in Minneapolis, Minnesota.
Thank you so much for joining us. And we're thrilled to have Dr. Mallon as a Minnesota Oncology, and her in particular have been one of our top enrollers to our GOG Foundation studies. So I'll just kick it off, Dr. Mallon. I'll ask a couple of questions. Feel free to intervene with anything that you need to add, because we really want to hear from you. But first, kind of a general question. What does successful enrollment mean to you for your trials?
That's a great question. I think that success can be measured in many ways, but for me personally, every single patient that we put on trial is a success because it means that they have access to a new therapy that they wouldn't otherwise have access to. So I think those are the daily victories or weekly victories that we can celebrate in clinic. And then another success that I view is being able to find a trial for every patient that's coming into clinic too, and at least be able to offer it to them.
Exactly. So what you're talking about is building a good portfolio. So you
Yes.
have trials available for patients with different cancers and different phases of their cancer journey. So excellent. Okay, so I guess now just down to some actual tips on what you do. So how do you or in the other investigators at your site identify potential patients who are candidates for a trial? How are these patients identified?
Yes, great question. So, in our electronic medical record, many times we are trying to put in a chart note or a chart flag for patients that could be possible trial candidates. We're also using some technology to try to identify some lists of patients as we know newer trials that might be opening. And then we are trying to update at least monthly through our own research meetings locally and nationally, and trying to highlight some of those trials so people can think about their upcoming clinic schedules and the upcoming patients that they'll be seeing as well.
Excellent. Yeah, I think that's a good point, is that it's really important to identify patients before they're seen. So looking at clinic list, maybe, I know that some sites will do huddles and they'll include the research nurses to you kind of look through the list, who's coming in, who's currently on platinum resistant treatment and may be eligible as their next line of therapy for one of the platinum resistant trials. Thinking about trials that have a screening consent that can be done proactively, and also
Mhm.
discussion with the patients ahead of time. Maybe a trial will be something that we can consider for your next line of treatment. So
Mhm.
I think all of those things are really important. Okay, another question. So how do you view your role? What's your role at your site personally in driving accrual?
I think just being enthusiastic and excited about trials and having them be a part of the normal patient experience, I think is one of the biggest things that you don't always think about that you're doing on a daily basis. But that's the feedback I've been given is that many of the specialties just look to our GYN oncology group as a group that's always been very motivated and has put patients on trial, and we've become these leaders in the workplace, even if we don't always think about that. But I do think just normalizing the clinical trials, like you had alluded to, as part of patients' care for oncology, I think has been the culture that I was been fortunate enough to be part of by the senior partners, and a culture that I want to continue um, throughout my career as well. So I think that that's really helpful because people just see that as just an integrative part of their entire oncology journey.
Yeah, I think you bring up a very important point, and you mentioned several times culture. And so that's the thing is, and the title of our series is Accrual Culture. So it's about building a culture at your site where people are engaged, people are excited, people are aware of trials, and it's everybody. It's not just, the principal investigator, but it's the sub-Is, it's the research nurses, it's the PAs, it's the data managers even. I mean, everybody has to be involved in this. And I think I don't know if Dr. Copeland was the first one who said it. I don't think so, but I remember at a meeting years ago, he said, or what did he say? Culture eats strategy for breakfast. And that was just something I think I even wrote it down because I think it's such an important point because you can strategize all you want, but if you don't have the engagement and the culture, I mean, you're not going to be successful. So, okay, so walk me through what happens when an eligible patient is identified at your site.
Yeah, so try to screen them ahead of time and have at least one or more trials identified that can be offered to them. Ideally, try to get the patient approved materials if possible, just to be able to bring that in the room with me. And then I really try to introduce it myself as the first person to go into the room and just let them know that these are options and that these are that trials are purely voluntary and optional, but this could be a very important part of your care. And these are the trials that are potentially available to you right now. And we're happy to walk through it today. And then I'll usually try to bring the research nurse in afterwards if they express any interest whatsoever. And then they'll walk in later after I've had the chance to review with the patient and answer any questions.
Excellent. So it sounds like you kind of already answered the next question, which are what do you find most helpful in making patients feel comfortable enrolling in a clinical trial?
Yeah, so I think that a lot of the times I've encountered patients, I think, being nervous or scared. I found that dispelling some of the myths that surround trials has been helpful. I think what I have encountered is that most patients are scared that going on a trial would make them have only a placebo and not get cancer treatment. I've been surprised over and over again how many times I've heard that. And I think that is a common misconception. And so I think just being able to explain that, particularly for oncology trials, that would be unethical, right? We're introducing trials to them. And I try to really tell patients that we have to guarantee you standard of care, right? So many of our trials, you might not receive the experimental drug, but it would be unethical for us to not be treating like your cancer in some way, right? And so even though a lot of our trials, you might be randomized and you still might get standard of care treatment. We can't not give you, most of our trials, we would not give you treatment. And I think once I've realized that that tends to be most people's concern, once they've heard that, I find that that tends to be, for at least what I've encountered, is tends to be the biggest barrier, I think.
Yeah,
On
I
trials.
agree. I totally I have that same conversation. You have to say this is a randomized trial. And we
Mhm.
do have some trials with placebos, but for the most part, you're randomized to standard
Right.
of care versus the investigational treatment, which may even include the standard of care. So yeah, you just say it's not a placebo, you're getting what we normally do. So I
Right.
think that's super important. And I also like the fact that you said you were the one that brought up the trial with the patient because you have the relationship with the
Mhm.
patient trusts you. And I think that's so important. You just bring it up and you talk about it early. You don't wait. A lot of people, I think, are patients, and even physicians think you go to a clinical trial when there's no other options. And that's just not
Yeah.
true. You always have the standard of care options, but you might not always have access to certain clinical trials because it could be closed. So
Mhm.
thank you for that.
Bring up a really good point, Dr. Cloven. That is the other thing that I've encountered too is that um, the number one is not getting treatment, and then number two, thinking that they're a worse prognosis when you
Mhm.
mention that word,
Not at
or
all. Yeah.
thinking that that means end of life, right? And really dispelling that myth and telling people that most of the time, even the standard of care regimens have been developed recently, right? That they're now on.
Right.
they've all
Exactly.
come from a clinical trial. And so I think it eases people's fears when they get to hear that from their doctor.
Yeah. Thank you. Okay, so I think this is a very important question, and it's something that I don't think we really talk about that much, but um, I think it's very important to celebrate successes with your staff and your team to help kind of build that culture that you were talking about. Is there anything that you do in specific to, bring recognition to people, or how do you handle that at your site?
So I think that that's a great question, and I would like to think about how to maybe do that more formalized. Right now, we do acknowledge people at our annual like work meetings,
Mhm.
and certainly through email and in person, and very celebrated when we're seeing the numbers. On a very small scale, interestingly, when we've alluded to culture as well, I actually my office at work. We've turned into just these research meetings once a week, more informally, just as we're going more through the day to day outside of our scheduled meetings, and just creating more of that space where people are feel they can just come in and ask questions. I think it's helped. I have coffee there for anyone that wants to use it. I have a couch. Our clinical research leader said, "Should I get a couch in my office too?" And I said, "Absolutely." And so I think even just creating those small spaces, I found that there's just more conversations throughout the day. And that's helpful too, to just talk about each of the patients, not always in a formal meeting, but certainly those are the fun times that at work too, where we're celebrating somebody signing pre-screening consent or screening
Right.
consent. And so that's been fun too. But I like that you bring that up for the team. We should think of something that is um, more formal every year.
Yeah, no, I think one thing that I try to do is I think it's really important. Let's say, for example, that there's a trial that you have open at your site and there's some data being presented in a national meeting or it's published. The team needs to know about that. Hey, this is our work. Look what our study did. Now it's being presented at this meeting or it's published in the New England Journal of Medicine. And our patients were on this study that helped make this happen. Or a drug gets FDA approved. This is something that they need to be aware so they know that what they're doing makes a difference.
Yeah,
So.
that's a great point. I love that.
So I think this is the last question, and I think this is also important. Do you think that enrollment performance affects your site's reputation? And do you notice referrals or more sponsor engagement with your site based on your high accrual?
Absolutely. I think that building a portfolio is so critical to providing best patient care. And if you've shown success, more sponsors will want to engage with you, and you're more likely to be a site that's selected, right? Because you've shown a track record that you are able to enroll patients on trials. And so I do think it's very important to take every trial that you open very seriously, and try to do a good job and try to offer for all the appropriate patients, because I do think that that will get rewarded over time, and that patients trust you and that you have a very robust team and staff that is able to support those trials, and you're able to continue to build that team by showing that they're necessary, and that they're very needed too.
Yeah, no, I agree. And I think it's just, patients, nowadays patients are very involved. They're becoming more and more advocates for their own health.
Mhm.
And so I've noticed patients who will self-refer themselves because they saw, us listed as a site with a clinical trial. So
Mhm.
I think it really does help, that patients know when they come to your site, they're going to have access to,
Mhm.
you know, um, the most up-to-date
Mhm.
options, not just standard of care. I mean, of course they've got that, but they have other options as well.
Mhm.
Um,
No, you bring up a good point, Dr. Cloven. Our patient population, taking care of women with GYN malignancies, they are very savvy and they are very smart, and it's nice when patients talk to other patients
mm,
and really are spreading word of mouth about what's available to them. And I find patients are willing to even temporarily relocate if they need to, just to be able to get on some of these trials. So you bring up an excellent point.
Yeah, I think it's so good to see patients who are educated, and we just it's just something to be prepared for, and because yeah, a lot of one of the main reasons patients don't enroll in trials is because no one talked to them about it, right?
Mhm.
So patients are looking on their own now, and I think that's
Mhm.
that's good that they're taking charge.
Yeah.
I actually was wrong. There's one more question, and what this is if you could change one thing to improve the enrollment at your site, what would it be, and where do you think you can have the biggest impact? You're already great, you're already awesome, top of the list. But if there's one thing that you could do, what would you do to help with enrollment?
Just being able to get the trials open as fast as possible. If I could pick one thing right now, that's what I would pick.
Okay,
Is
no,
is
that's
once the
important.
once the site's been approved, is getting it open because especially for some of these ovary cancer, these upfront ovary cancer, it's I just feel we go through the site visits and we're approved, or we're waiting for IRB, or we're waiting for one more thing, and you're seeing these new clinic patients and going, oh, I really want them on this trial, but just timing wise. So you're knowing it's coming. And so I think that right now has been just the biggest challenge, is being so excited about it, but not yet being able to offer it, and feeling like you're missing people in this, 2 to 4 week window that you're seeing in clinic, that you just have to start on treatment, right? So,
You're so right because and that really does. It has an impact downstream too. So if you're one of the first sites to open a trial, your enrollment numbers are going to be higher because you have a longer enrollment period. So if you're waiting and the trial's already open and people are enrolling and enrolling, that just shortens the time when you can enroll. And you're right, it does. People get excited, and if there's delays in opening a trial, that really does dampen enthusiasm a little bit. So, but that's something that we all could work on, I think, is
yeah.
is that. So
And speaking
to
and
go on.
speaking about enrollment, this is one of the biggest helpers to help with enrollment is Hugo, the gynecologic oncology pet therapy dog. So he always comes in and invokes a sense of calm. Ugh, come here, buddy. Oh,
Oh,
yeah.
okay, so
So
yeah,
he's usually there as people are walking through their screening consent, and brings some good energy.
that's so helpful. Yeah, it's always good to have a dog involved. So, well, thank you so much, Dr. Mallon. That was wonderful. Thank you for all the good tips. I'm sure we'll all pick up on some of those and use those at our own sites. And we look forward to working with you in the future. Thank you so much.
Thank you, Dr. Colvin, and thank you for being such a great mentor to everybody and being so enthusiastic about trials too.
Oh, you're welcome.